and from Chair Karen Redman about COVID-19 and our community, and we'll take questions from media following their updates. We will have a slight change in the briefing today. Following the health updates and questions, we will also take follow-up questions regarding the plan, budget, and Beyond COVID Service Review 2019 Implementation Report. That was a report that was issued earlier this morning. So we'll start with our health update, and I'll pass it over to Dr. Julie Emili.
Thank you, Carrie, and good morning, everyone. Over the past week, we have seen a significant increase in the number of cases and outbreaks in Waterloo Region. We have also seen a similar increase in the number of high-risk contacts that require follow-up. We see that the spread of COVID-19 often starts at social gatherings or events. This is leading to multiple clusters of cases and outbreaks in various settings in our community, such as workplaces and businesses, schools and post-secondary institutions, congregate care settings like long-term care homes. This is consistent with what is being seen in other communities across Ontario. Over the last week, we have reported almost 300 new positive cases. Given the continual increase in our cases and complexity of outbreaks over the past week, we have met the indicators in the orange restrict category of the provincial framework. Our current weekly incident rate is 46 cases per 100,000. Our current percent positivity is 3.6%. This number takes into account interim data that is not yet finalized and may be subject to change. Our reproductive rate is 1.5. We have observed an increase in outbreaks in multiple settings and sectors, with outbreaks in long-term care and retirement homes, workplaces, congregate care settings, and other community settings. This means the spread and circulation of COVID-19 has significantly increased in Waterloo Region. Our hospitalizations have remained stable, but this is a lagging indicator, meaning that there is often a delay between when someone tests positive and when they experience severe illness requiring hospital care. Our hospitals are also reporting high occupancy levels, meaning that a shift in hospitalizations for COVID-19 would have significant impacts. In the past 7 days, our ability to reach cases and contacts within 24 hours is 92.4%. We have asked the province to reassess the appropriate level of measures for our region based on these indicators. As such, we expect that Waterloo Region may be moved to the orange restrict category pending provincial cabinet approval. Locally, we have also executed on our plan to increase staff for the second wave. We have put a number of measures in place to help us manage this surge, including reallocating staff, requesting additional help from the ministry, working with Public Health Ontario for follow-up of contacts, and pursuing virtual initiation of contacts. We are also looking to add recommendations for long-term care and retirement home settings, including discontinuing indoor visits by general visitors and limiting all indoor visits with residents to one essential visitor. We are also collaborating with a multi-ministry team of provincial offense officers on an education and enforcement campaign for 2 weeks, beginning on November 16th. This supports our current efforts to build awareness and ensure workplaces can stay safe and stay open. We will consider adding more restrictions if the measures are not enough. We appreciate that the framework is new and that many organizations are adapting to the changes made last week. Some of the new intermediate measures under the orange restrict category would include all previous measures from previous levels, as well as limiting indoor capacity to 50 people, limiting operating hours, closing at 10 p.m. with alcohol sales ending an hour earlier at 9, requiring the screening of patrons through a questionnaire, limiting to a maximum of 4 people seated together, prohibiting personal care services that require removing a face covering. As we have seen over the past 2 weeks, COVID-19 can accelerate rapidly. We recommend that businesses make plans for each level of the framework because, as we have seen, as cases accelerate, we can quickly move into the next level of measures. We all have a role to play to slow the spread in Waterloo Region. We are asking all residents to continue to practice public health measures. Wash your hands often, limit close, unprotected contact to only your immediate household members. Practice physical distancing and wear a face covering or mask with everyone else. Gather virtually instead of in person. If gathering in person, practice physical distancing and wear a face covering. Gather outdoors or in well-ventilated indoor spaces and avoid crowded places and enclosed, poorly ventilated spaces. Minimize, where possible, the number of people at a gathering. Stay home if you are sick, even if you only have mild symptoms, and seek testing. We appreciate that these changes are significant. These restrictions are necessary to protect vulnerable settings, for schools and businesses to stay open, and to enable medical procedures and surgeries to continue as much as possible. It is vitally important that we all do what we can to support our local hospitals and ensure that our health system capacity does not become overwhelmed. We know COVID-19 spreads easily indoors and in close contact. It does not discriminate. No setting is exempt from the potential for COVID-19 to spread. The goal of moving to orange is to be preventative in nature, to delay even further restrictions. These are challenging and rapidly changing times in our community, but we can do this together. Together we can and will make a difference. Thank you.
Thank you, Dr. Emili. We'll now have an update from Regional Chair Karen Redman.
Thanks, Carrie. Now that we've heard from Dr. Emili and she's reported on our continual increase in cases and outbreaks in Waterloo Region, I want to be sure to emphasize that our numbers indicate we're moving into the orange level of response to COVID-19. This is designated the restrict category. I've been in contact with Minister Elliott's office to stress our support for the province to move Waterloo Region into this level quickly, and understand that it will likely come into effect Monday, November the 16th, but we await confirmation from the province on this. Under the direction of Public Health, Regional Council is supportive of moving to this next level as a way to be more proactive rather than reactive to the increasing COVID-19 spread in our community. The new category requires many of the same public health measures as before, but with more restrictions to some businesses and limited gatherings. As we learn more about these new measures and the changes required for Waterloo Region businesses, Regional Council, as the Board of Health, will work with Public Health and Best Waterloo Region to get the information out to businesses quickly. If we want to slow this surge, we must follow the measures of regular mask wearing, proper physical distancing, hand washing, staying home while sick, and not letting our guard down when we are with family, friends, or coworkers. Back in the spring when we were in lockdown, the community came together to help neighbors, family, and friends when needed. Now that the second wave of the pandemic is here, things have changed. Businesses and schools are open, which means people have to return to work and have less time for volunteering. Waterloo Region's pandemic volunteer program has an urgent call for volunteers. They're looking for drivers and kitchen help to assist in a number of organizations to ensure food deliveries can continue for people who are isolated due to COVID-19. This program is an example of the community partnership and kindness during the pandemic. It ensures all agencies, registered volunteers, and the people they serve as part of the response are protected from COVID-19. Those interested in helping can visit www.volunteerwr.ca. Earlier this week, the region and the Grand River Hospital announced the use of the former Charles Street Transit Terminal in downtown Kitchener as a drive-through testing site. This speaks to the great partnership that we have with Grand River Hospital. It also speaks to finding tangible solutions through community partnerships and we're confident that this solution will help many residents throughout Waterloo Region access COVID-19 testing throughout the winter months. The initial agreement is from November the 9th, 2020 to March 31st, 2021, with an option to extend for a further 6 months. They plan to use the bus lanes for queuing and testing, the passenger pods, catwalk, and lunchroom as staff areas, and the ground floor lobby as a walk-in testing center. This winterized test site is anticipated to open in December. This Saturday and Sunday is Diwali and Bandi Chor Divas, also known as the Festival of Lights. Diwali represents positivity and optimism and celebrates the triumph of light over darkness, something we could all use right now. During this time of year, Hindu, Sikh, Jain, and Buddhist members of our communities celebrate by dressing up in formal clothes, lighting diyas around the house, praying, lighting off fireworks, exchanging gifts, and having a festive meal. This year, we're asking the community to celebrate differently. Due to our current COVID-19 spread, we're asking anyone celebrating to please follow public health guidelines. This means practicing social distancing, limit indoor and outdoor gatherings, and wearing masks. I hope you're able to make the new tradition of celebrating with your family and friends virtually and decorating your home with lights or diya. One of the manders in Cambridge is encouraging all residents to put up their Christmas lights early this year to also celebrate with a festival of lights. What a great way to lighten our spirits. If you're going to the mandir or Gurdwara, and that's part of your tradition, we hope that you can practice your prayers at home or join in a virtual live stream online prayers. Just like all holidays so far, we have had to find different and safe ways to connect with our loved ones and celebrate special days within the confines of our homes. We need everyone to step up and do their part so that no social gatherings. The situation is just too precarious in the community right now. Lastly, I'd like to mention we announced the 11 community members of our Anti-Racism Advisory Working Group. A selection committee of 5 BIPOC community leaders suggested the region, through public input, created the criteria and the terms of reference for this advisory working group. They chose 11 members from the group of over 70 passionate and qualified applicants. We're grateful to the selection team for taking such care to recruit skilled and experienced committee members, and we're grateful to everyone who applied. The selection committee members will tell you that they have a difficult job in selecting the 11 members. I'd also like to thank everyone who participated in the 2 town hall meetings where we heard from many racialized residents. It was their input that led to the creation of the Anti-Racism Working Advisory Group. COVID-19 has amplified the inequities of the BIPOC and our most vulnerable population. These members will play a significant role in helping eliminate systemic racism in our workplace and in the services the region provides. They will provide recommendations, advice, and information to Regional Council through the Anti-Racism Plan. Thank you, and back to you, Carrie.
Thank you, Chair Redmond. With that, I will turn it over to questions, starting with Kate at CBC.
Thanks. Carrie, do you have an enforcement update at all for us?
A very brief one. We have no enforcement actions to report.
All right, then. Thank you. Dr. Emili, we saw Dr. Nicola Mercer in Guelph issue a Section 22 order regarding the Mennonite community. In particular, they have to close schools and churches. Is something similar being considered here in Waterloo Region?
We haven't had the same issues in Waterloo Region as I understand they've had in Guelph. So we're not considering that at this time. We do work with that community. We have a number of staff who have worked with them for a long time. So we would explore how to best approach this, but currently we haven't seen that here.
And in terms of next month with the holidays, I'm wondering, I've heard a couple of different school boards or provinces say, rather than the 2 weeks, they might take a month. And I'm wondering if public health has been having that conversation with the local school boards about whether or not more time needs to be taken off at the holiday break rather than the traditional 2 weeks?
So that would likely be a decision that would be made on a provincial level. What we do know is what happens in the community spills into other settings like the schools. We have done very well over the past several months in terms of keeping schools open and having very limited number of outbreaks, and been able, even when there is a case in a school that's result of what's happened in the community, it hasn't spread except in a limited number of settings. So I think that still would be under discussion, but it would definitely probably be at a provincial level. And what I would say is it really is the messaging we've been giving about how each of us and our behavior impacts what happens in all these other settings. So I think that's still something to be discussed.
Great. I'm going to leave it there, but I reserve my right to ask more questions later.
Thank you, Kate. Next, I have Nicole at CTV.
Hi, good morning. Thanks for taking my questions. First question is, why wait for provincial confirmation to go into the orange? Because earlier this week, we saw Dr. Lowe from Peel enact his own orders above and beyond what the province categorized Peel as. And when looking at their outbreaks, they don't have double-digit outbreaks at workplace settings, but we do in Waterloo Region. So why not take the step that Dr. Lowe is taking and just enforce your own restrictions?
So we are always looking at what is happening currently with our numbers and looking at what is available to us through the provincial framework, and also what additional measures we could consider. And so you can see from last week, we've had a rapid increase over less than a week in terms of our numbers. So we've been assessing that over the course of this week and engaging with the province. The province's framework has a reasonable set of measures to implement as our next step. As we've done throughout this, we've always taken a reasoned approach to this. And so implementing those measures would be a first step. It doesn't mean we wouldn't do additional measures if we need to. And in my briefing, I did discuss how we are looking at providing additional recommendations to long-term care homes, especially because they are such a vulnerable setting. So it's not that we haven't ruled that out, but our approach is to first try the provincial measures to see how that does, and then consider additional measures as we need to.
Can you provide us with any updates in regards to the outbreak at Algarve? We know yesterday it climbed to 11. Can we expect additional cases? And has Waterloo Region heard from the 175 people potentially exposed?
So this is a unique outbreak. As you know, we haven't usually posted, but because of the size and number of it, potential exposed and contacts, we didn't have the ability to deal with each of them individually. So we have had some calls, but we also expect many of them would go and get testing, and then we might hear through them through that route. The latest update I have is that it is 11 cases, but we have a number of cases that come in overnight. And then as the day goes on, we are able to figure out, is there a link with any current outbreaks? With any outbreak, we always expect until the high-risk contacts are tested that the numbers will grow, because as more people who are tested that we had considered exposed, there is the potential to grow. And since if we think about incubation periods and it takes 14 days after exposure, we always anticipate up until that 14-day mark of the last case, we could continue to see cases. And so as we investigate them, and if we have more linkages, we will update that on the dashboard. But my latest number is still 11.
And my final question right now would be, what recommendations does public health have for visits with Santa at local malls or businesses as we get into the holiday season?
So our recommendations regarding visits with Santa is very much the same as recommendations regarding our interactions with anyone outside of our household. So it really is about maintaining physical distancing and about wearing a mask. I think we're all going to have to think creatively about how we honor traditions in our community, similar to what Chair Redmond was saying about Diwali. We want people to still celebrate holidays that are special to them, but we have to think of doing it in different ways.
That's it for now. Thank you.
Thank you, Nicole. We'll go to Joanna at Waterloo Region Record.
Thank you. Just a question about moving to the orange level. Do we need to wait for the province to okay this, or is it possible for us to move into that ourselves without their approval first?
Dr. Emili, I'm just going to jump in because I was going to actually give this answer to Nicole's question, and then you can add to it. Medical officers of health do have the ability to bring additional restrictions, but when we go from one level to the other, Joanna, specifically if it is around a whole class or a type of business or service, when the province puts us in that category, there is access to some funding that wouldn't necessarily be there if we were moving out of sync with what the province directed.
And what I would say in addition to that is there is a provincial framework that has been put forward that's new, and we're still all exploring it and working with it. And so we expect to hear from the province hopefully soon. If we are not moved to orange, we wouldn't be able to move ourselves to orange, but we would be able to look at what additional measures would be under the jurisdiction of the medical officer of health to implement in our community to address the issues we're seeing. So we hope to hear soon, and then we will make a decision about whether or not additional measures would be needed if we were not moved to orange. But we are expecting that that announcement will happen soon. And we certainly have advocated for it.
And by soon, do you mean today?
Yes, that is my understanding.
And Chair Redmond, you mentioned additional funding. Could you elaborate on that a bit?
I actually don't have the detail. I can get back to you on that, Joanna, but there is funding when, say, a class of service, whether it was congregate settings, I hesitate to name them, but we've talked about gyms and they've talked about certain services. And if a class of business gets shut down by the province because we've now gone into orange or red, they can access some business interruption and some support funding from the province that is available. So Dr. Emili is talking about we could do additional restrictions, but they probably wouldn't be a whole class of service or business. And if it was, they wouldn't be eligible because it would be something that was imposed locally as opposed to through the framework that the province has designed.
Okay, and can I ask one more question? Yep, probably for Dr. Emili. Are you feeling a bit frustrated? You mentioned that many of these clusters of cases are coming from gatherings and those sorts of things. Do you feel frustrated that people simply don't seem to be following the rules anymore?
I wouldn't say frustrated. I appreciate how difficult this is. And I myself have, we all have to do this and understand we're asking people to do things that are difficult. We're asking people to limit their physical contact and close contact with a smaller number of people in their household. We're asking the general public to change the way they're used to being. And we know this, we're, many months into this. And so it's been hard for everyone. And so I appreciate why there are challenges. And I think people have the best of intentions. And I don't think people intentionally, do this and mean to not follow the public health direction. It's just reinforcing to them that the impact is great because one case results in often then transmission within that close household or close friends. And then social gatherings, as you get more cases, spread to workplaces, spread to schools, spread to long-term care. And the fact that we have 18 outbreaks right now in the community is reflective of that chain of transmission that you get it, but then it spreads somewhere else, and it spreads somewhere else. So I think what we keep trying to do is reiterate the importance of our own individual behavior, because we know we can limit the number of outbreaks and the degree of outbreaks if we all follow these rules. I recognize, though, how difficult it is, so that's why we keep reiterating this is important to do and why, and that, you know, this is going to be something that we continue to do, and it is, we've talked about it a lot, calling it the new normal. So I wouldn't say frustrated. I appreciate where it comes from, but it does make our job difficult and the hospitals, because it's hard for us to manage the number of cases we are getting on a daily basis and our ability to do these complex contact investigations.
Thank you.
Thank you, Joanna. We'll go to Damon at the Woolwich Observer.
Hello, I'm not sure who my first question is. I was just looking to learn more about the campaign with the provincial enforcement officers. If you could provide me some more details on the specifics of those positions.
I will try to provide details, and then we can follow up with more details later. The purpose is really to bring together a number of agencies who do enforcement and work with workplaces and businesses to help provide them with additional support and identify where maybe they might do better or think of doing things differently. So it is really meant to be supportive in nature, because a lot of times when we see transmission occurring in workplace settings, it's often the behind the scenes, in the lunchroom, when you carpool, when you take a break. And so it's really supporting workplaces to optimize their practices as much as possible. It's going to start over the next 2 weeks. And we've identified from our perspective where might be some areas that would need additional support. And if you look at our dashboard, some of those types of locations of outbreaks may be where we will target those efforts.
I'll also add that the ministry partners are going to help us in inspecting facilities that we don't usually have an established relationship with. So our public health inspectors are often inspecting restaurants and other food services, personal care settings. With these ministry partners, we're able to get into different types of workplaces.
Thanks, Gary.
Okay, and then I have a question. Sorry, I lost my train of thought for a second. Okay, so right now there are 18 active outbreaks in the area, and a lot of them are at retirement homes or long-term care facilities with 1 case. And then if you look down to schools, there has to be 2 cases with an epidemiological connection. Is that still kind of misleading for case numbers? For me, it's hard to understand the difference and why it's not both labeled. So some schools might have cases, but they're not labeled on there, and it just seems a little misguiding.
Okay, so how we decide what to post on the dashboard is a combination of what we are directed to post, or our obligation from the ministry, and then some of it is how we want to represent what's happening in the community so people understand what is happening. With the school outbreaks, we are the ones legislated to not legislated, but are supposed to post the outbreaks. The Ministry of Education maintains a separate website, as does the school boards for individual cases. So we do have a link that allows you to go there. It's just about where we post it. And within our schools, the cases in the schools are reflected in our case numbers, and it's really a reflection of what's happening in the community. The transmission in a school setting, which is really what's reflective of what's happening in a school, is what outbreaks are about. And as you can see, we don't have a lot of transmission within a school setting. And similar to long-term care, we've been fortunate that the layers of infection prevention and control measures have allowed us to limit the extent of transmission or the number of individuals impacted in those cases.
Okay, and a lot of transmissions are happening, social gatherings.
Mm-hmm.
At these, I guess, gatherings, are people following measures, or is it just?
I think some of it is we all tend to think we aren't at risk, or the people we know aren't at risk. And so a lot of transmission occurs with family and friends who are outside your household, that you don't wear the mask and you don't do the physical distancing. And when we think of many of the outbreaks that are occurring in workplaces that are posted, as I said, a lot of it happens when people aren't distancing or wearing the mask. So it could be lunch. While you're eating, you're obviously not going to wear a mask. When you're out on a smoke break, you're not wearing a mask and you may not be physical distancing. So a lot of the places even we're seeing outbreaks are places where if you're in a food service setting, you're not wearing a mask while you eat. And so you're at a table with people who may not be in your household. So in terms of where we're seeing transmission occur in social gatherings or certain settings, it's in times when you're not so physical distancing or wearing a mask, whether because that's allowed and some of that is being addressed as we move to the next stage in terms of limiting who's at a table. But it comes down to the basic public health measures of keeping distance and wearing a mask when you can't.
Thank you.
Thank you, Damon. We'll go to Tim at 570.
I was just wondering if you have any other information about the confirmed case in a staff member at Elgin Street Public School.
So we would not share any details about individual cases.
Okay, perfect. Thank you. Now, we're seeing a lot of people who believe that freedom is being taken away from them with things like mandatory masks. And in the region, we're seeing cases rise. And down the road, we like you just said about Orange in the restricted category. How worried is public health and the region that some people aren't just going to listen and they're just going to continue to say things that their freedom is getting taken away from them because they do not want to wear a mask?
I would say for the most part, most people are complying with the recommendations as best as they can. I think whenever you ask people to do something that isn't necessarily what you what they want to do, you'll always have a group of people that don't agree. If we think of public health measures, we are asking people to limit their own rights, let's say, to do something for the benefit of the good. So public health measures often have a tension between what someone might want to do and what we want them to do. And so I would say by and large in our community, the vast majority of people have complied and done as best as they can. These circumstances I'm talking about, sometimes they may be intentional and people aren't thinking through the impact on others, but by and large, most people are trying to do what they think is best. And from the perspective of what we do about that and how we move people who aren't in agreement, it is really helping people understand what is the situation now and how their own individual actions impact the larger community and impact our ability to reach our goal of being able to keep as many businesses open as possible, keep kids in school, and keep our hospitals functioning and opening. And so the less people comply with public health measures, the less we're able to achieve that goal. And the result is we become more restrictive in the measures we have to employ.
And if I can add from a regional perspective, I think that the compliance, as Dr. Emili is saying, is very high. And I want to thank our community for being so diligent. There was a very pared down Remembrance Day ceremony on Wednesday this week, and there were a handful of people there. The vast majority of them were wearing masks, and I have been at Remembrance Day ceremonies in Kitchener where there were bleachers with thousands and thousands of people. Those people all stayed home. But the flip side of being compliant and putting the public good against above your personal preferences is also to be kind to other people, because we have to remember that some people are getting pandemic fatigue. We're asking everybody to continue to follow the guidelines of public health for the reasons Dr. Emili has just outlined, and that's for the greater good and the fact that we won't have to continue to go into more and more restricted times. But it's also really important to be kind to each other, and there are people who are complying and they're worrying if they see somebody without a mask, even walking down the street. So I think that being kind to other people is a really important message also to impress on the public.
That's great. Thank you so much.
Okay, we will go to Lauren with the Waterloo Chronicle.
Thank you. So since the new COVID guidelines have been adopted, cases in the province have gone up to record highs. So I was wondering how the orange zone will help lessen the spread of the virus in the region if in other areas it has been going up.
So what we're hoping is the less opportunities for interaction between people, the less opportunities there is for spread. And if we've looked at Ottawa, they actually, when they implemented more restrictive measures, were able to bring this under control. And so I think that's where we have to assess this on a regular basis. So if we're seeing, if we go into orange and that's not working, we'll always be looking at what are the additional measures that make sense. So we want the measures to match what we're seeing in terms of places of transmission. And so one of the reasons we are going to move forward, for example, with the recommendations to long-term care are because they're not included in the orange restrict category, but we want to make sure we enact these recommendations before we start to see large outbreaks like we did in the spring in long-term care. So I think it's something that we are constantly looking at and looking to see what have other jurisdictions done, what has made sense, but it's always a balance. We want to keep things open as much as possible and have people have as much ability to gather as they can within reason. And so the restrictions are really focused on how do you stop that chain of transmission and how do you limit the amount of spread. And so that's something we're always looking at.
And just to follow up, cities like Toronto that were initially classified in the orange have requested to be put into the red category. Would Waterloo Region ever request to be put into another category?
Yes, so we have done that currently. We've advocated to move to the orange category because over the past couple of days, we've noticed our numbers are increasing and we ticked all the indicators for orange. So we reached out to ask for that assessment and then are looking at, if this doesn't happen, which we do expect it will, if it doesn't, what other alternatives could we put in place to try and limit the spread within our community?
And then just lastly, has the recent increases in cases impacted the ability to do timely contact tracing within 24 hours?
Yes, and that's one of, if you look at the indicators, it's really about the epidemiology, so what's happening, and then the health system capacity to respond, both at a hospital level, which I talked about before. You don't want to wait till your hospital says they're overwhelmed because that indicator lags. And the second part is public health capacity. So it's increasingly difficult for us to get hold of contacts in the quickest manner we would like to, because we have so many cases coming in. We've had to institute a number of different measures to try and find efficiencies and prioritize getting to cases immediately so that they know they're a case and they know what to do. Because of the number of outbreaks, like I don't remember a time where we've had this number of outbreaks. I think we've declared almost 2 a day in this past week, and we're up to 18, and I expect we're going to continue to add more outbreaks over the next couple of days. When you have an outbreak, the complexity of that investigation is much more difficult, and the numbers of contacts, in the spring, we'd have like 2 or 3 people. We now have sometimes upwards of 100 to 200 contacts per case. And so that is becoming increasingly difficult. And that was one of the factors for considering going into orange. And what we're doing now is trying to prioritize our cases so that we can get to them as, in a reasonable amount of possible. But I do know we have some cases where we're having difficulty reaching them quickly for the contact investigation.
Mm-hmm. And if I could just quickly follow up on that, can you provide a little bit more detail on what those efficiencies or how you're prioritizing those cases?
Yeah, so we've done a number of things, try and increase as much as possible the amount of staff we have dedicated to COVID case contact management and outbreak management. We've reallocated staff from other areas and quickly onboarded them to do these activities. We've asked the ministry, we've reached out to PHO, and Public Health Ontario has been helping us with contact tracing actually, once we identify who the contacts are. And we've recently implemented a virtual assistant, virtual assistant, whereby we're sending, I think it's like a template to people to start looking at and recording their contacts so that when we call them, they've already thought that through. So then it takes much less time to do it. And we're constantly, I was just on a call this morning before I got on here to say, okay, what else do we have to do over the weekend to further prioritize and make sure we're getting to the contact investigations within a 2-day frame. So it's something we do. It could be multiple times a day. We're trying to reprioritize to ensure we get to people as quick as possible.
All right. Thank you.
Thank you, Lauren. I would like to add, if we do move to orange, remember that the incubation period for cases is 14 days. So we won't expect immediate results, and that what we're seeing today reflects that incubation period. Our next set of questions will go to Irene with Air News.
No questions, thank you.
Thank you, Irene. We've gone through everyone, so just opening up for a second round. So I see Nicole's hand first. Nicole, go ahead.
Hi. Firstly, is it possible that since there's an increased spike, and I think a reproductive rate may be in the red zone, could the province say, you know what, we're actually going to put you in the red zone? Do they have that capability?
I guess theoretically they could, but the one thing to think about with the reproductive number, it is highly influenced, because reproductive number is essentially, I'm a case, how many people do I spread it to? It is very highly influenced by number of outbreaks, right? Because in an outbreak, by definition, you've already spread it. So it's not the most stable number, no, I shouldn't say that. It's not the best way to represent spread across the community as a whole. It represents what's happening in these clusters or these outbreaks. So that in and of itself wouldn't be a reason to go to red, because it's not a great indicator for community spread as a whole.
Okay, and my second question has to do with modeling. So back in September, provincial modelers said by October, we'll hit 1,000 cases. Dr. Wong then said, you know, based on that, we would see 40 cases a day. Now that yesterday, the province came out saying we could hit 6,000 to 7,000 cases by mid-December. I'm trying to do math here. So I'm wondering, based on what Dr. Wong said, could we see as many as 240 or more cases a day by mid-December here in Waterloo Region?
Well, I'm not great with math either. Dr. Wong is. The way it's calculated is basically you look at that number and you divide by the percentage of the population. Sorry, Nicole, I was not prepared for that answer. But we would definitely see a higher number than we're seeing now. We just haven't had the time internally to look at the projections that the ministry released, I think mid to late day yesterday, to actually apply it to Waterloo. And so maybe that's something, Carrie, we can have ready for next week.
Could you give us the formula? We could try and work it out ourselves.
I don't even know what the issue is with how they do the modeling. We have to figure that out first to be able to apply it to Waterloo. And it's sometimes not as intuitive as you would think. So we will look further into that, Nicole, and see what we can get back.
Okay. Kate, Kate, I saw your hand. Go ahead.
Thank you. Forgive me if we've gone through this before, but with the restaurant outbreak, are we able to break down exactly why there's 175 potential exposures there? Like, do we know who quote unquote patient zero is in that case? Like, is it a staff member?
Yeah, it's not just about patient zero. You have to kind of look at what does the case story tell you in terms of usually there's multiple cases over a certain time period. And so what you usually will do is say who could have been present during that time period. And because of the fact it's a restaurant setting, it would be anyone else who dined during those time periods when other cases were deemed to be infectious. It's not necessarily about staff or patrons. It's just who else would have been there. And that's why in that case, because of the number, we did have to go public because we wouldn't have been able to contact that amount of people in a quickest time as we needed. Versus with media, you helped us get that message out quite quickly.
Hey, we're useful.
Yes.
My other question is, and I feel like I'm going to make you repeat something, and Dr. Wong has sort of talked about this before, but we do keep hearing from people, the cases right now really aren't that much different than what was in the spring, but because testing was low in the spring, we didn't see as many cases. Now we've talked about test positivity, but I don't think the general public necessarily understands what that means. So I was hoping you could just briefly break down very simply what's different now compared to spring cases where maybe we weren't testing as many people.
I think with any time you're dealing with an infectious disease, there's really a number of factors that help you understand the picture better, right? And so when you look at the framework, that includes a number of them, and our dashboard includes a number of them. So one, it's just your number of cases, right? What are the number of cases we're getting every day? What do they look like? Like what's the makeup of it? Are they younger? Are they older? What's the situation in terms of how sick are they? And then where are the settings that we're seeing outbreaks occurring? And then looking at, even within our community, where are cases tending to be and what might be risk factors we need to address. The issue with testing and percent positivity is basically of all the tests done, what's the percentage that are positive? So the higher percent positivity means there's much more people being positive. It's influenced though by the number of tests that are done. What you can see is in the spring, we did not have high lab capacity and it wasn't opened up to everyone. So in the spring, we probably missed some people that were cases, right? Because the advice then was, unless you're in these high risk groups, you have COVID symptoms, you isolate. Now, over the summer, it was expanded basically to anyone who thought they might have COVID or want to get tested. It was open. So we got more cases in a broader segment of our community because more people were eligible to be tested. In September, we narrowed that down again, but we're still seeing high rates of cases because we're reaching the right people. So the fact that our percent positivity is increasing, even though we've limited, not a lot, but a little, who can get tested, means that the amount of spread in our community is high. That makes sense?
It does make sense.
Okay.
Thank you. That's it for me.
Nicole, I see you again.
Any idea? I understand that Premier Ford changed his travel plans and is speaking with the Chief Medical Officer of Health at a different time at 2:30 today, which signals to me that something may be coming down, which could then make a moot point in terms of the restrictions that you're asking for if he imposes further restrictions. Any idea in terms of what he may be announcing, and is the region ready if he does declare some sort of localized state of emergencies for certain regions?
I can't anticipate what he will be saying. What I will say is, I think throughout COVID, we have to have the ability to respond to things we didn't plan for, because a lot of this is really adjusting our response according to what's in front of us and what's the issue of the day. So I think if something comes out we're not expected, we'll have to look at it and see how do we apply this locally. I'll defer to Karen if she has any more insight than I do for that answer.
So Nicole, I think your spidey senses are probably pretty good. We too look forward to 2:30 to find out if there's an announcement. I guess it's really important to reiterate that Shu Lee and Dr. Emili and our Officer of Medical Health, who are acting at the time, are in constant contact with the province and the experts, as well as their colleagues across the province. I've talked on several occasions to Minister Elliott. I've talked to Dr. Williams. So there is an information loop and there is consultation going on. These are directions and guidelines that the experts of the province proclaim that apply to all regions or different regions, but they are talking to us. So I can't anticipate exactly what he's going to say, but I think we probably have a good idea, and they're using the feedback that the communities and public health officers are feeding back up to them to find out how it's sort of impacting on the ground, how it's impacting the economy. And just a side note, I did put in the chat box, Joanna and Nicole and anyone else who wants the link that talks about the funding that's available to businesses when they're closed down during the pandemic by the province due to guidelines.
Thank you.
My mute didn't unmute. So I think this concludes the, oh, I see Joanna.
Just a quick question. When the region hears back from the province about being moved to orange or not, is there going to be a release that's sent out?
So
I believe the province is intending to issue a media release for any potential changes to the framework.
And then we will look locally as to how to best get that message out to our businesses and community. We're hoping that announcement will come soon. Maybe that will be the 2:30 announcement.
And just to reiterate, the regional council is always working with Best WR to make sure that our businesses have a one-door entry to this kind of information. So we will disseminate it through them, and both Chambers of Commerce and Communitech and Waterloo Economic Development are all part of that.
Thank you. So I believe this concludes our health update for today. Thank you, Dr. Emili, for your time. For our media partners, we'll now open up to questions regarding the report Plan and Budget Beyond COVID Service Review 2019 Implementation. We are now also joined by Region of Waterloo Chief Administrative Officer Bruce Lackner, Chief Financial Officer Craig Dyer, Commissioner of Community Services Douglas Bartholomew Saunders, and Director of Children's Services Barb Cardo. So I will, if you want to raise your hand if you have questions, I will get you back in order. Okay, I see Kate first. Go ahead, Kate.
Thank you. We are already getting a number of emails about childcare centers and how is it possible regional staff are maybe considering closing regional childcare centers. And I'm wondering if someone could go over just how much of a financial impact these childcare centers are, why it's so difficult to run them, and why we'd consider closing them.
Karen, do you want to start or do you want me to?
I can start, Bruce, and then if that's okay. So I guess, Kate, we really want to emphasize that the region is looking at a $20 million gap between the money that we have available and the services and the costs in the 2021 budget. And we recognize that quality licensed childcare is vitally important to the recovery of the economy. We're looking at this as the service manager. So we are the oversight. We're responsible for the entire system, which is 14,000 childcare spaces in the region and 67 different childcare operators. We happen to also directly operate 5 centers, and so we supply 1.9% of the childcare directly, and yet the region uses just over 10% of the child service budget. So what we're looking at is there a better way to serve childcare throughout the region that looks to quality, looks at accessibility, and there's also an issue that when we own facilities, there's investment, and over the next probably 5 to 7 years, there will be a $10 million investment required in our childcare centers. So it's really looking at prioritizing where we are investing money. Can we take better advantage of taxpayers' funds by investing differently in childcare, and also looking at other services. So this has been reviewed. It started out with KPMG. I think it was in 2015. It was again reviewed with money that the province gave in 2019. And the Children's Center Review Steering Committee has recommended this to council. There's been no decisions made yet. It will be at the, there'll be a discussion, there'll be a public meeting, and council will make its decision. But it's not something we're doing lightly. It's something that we are focusing on how important childcare is for parents to participate in the workforce, especially women, and the impact that on children's outcomes, especially vulnerable children. So those are the kinds of issues that are being discussed in this, and I'll turn it over to Bruce.
Sure, and thanks, Kate, for that question. So again, I've received some petitions this morning, concerns from parents as well, saying, how can you not care about childcare during a pandemic? And that's not our intention at all. As Chair Redmond said, we oversee, as a service manager, about 14,000 childcare spaces. So we're thinking of all 14,000 children, including the ones who receive care in regional delivered space. We provide 1.9% of the spots, but use 10% of that overall budget. So what would the plan be if council approves this? And it's still an if, as the chair said. Certainly working with those parents and those children to transition those children to different opportunities in terms of childcare space. But looking at the fragility of the system is an important point. So the system's fragile, and that puts, almost 14,000 kids at potential risk if the system collapses. So the full part of this story is about improving affordability. So looking at all the spaces, and through widespread fee reductions is a good example. So we know there's many parents struggling before we got into COVID, and many more during COVID who can't afford access to childcare. So reducing those fees would be the transition that we would move to, instead of the current model where we're spending 10% of the funding on a small number of spaces. Sustaining those existing childcare programs is a big piece of this. Enhancing quality, and Barb may jump in here, but quality across the system. So it's important that we enhance quality for all 14,000 children, and not just some. Quality is important for everyone. There's no child we want left behind in this. And then equity is another super important part. And in particular, talking to our Black community and our First Nations, Inuit, and Métis communities, and how would and could we improve equity in terms of access and offer more culturally appropriate care, are things that we need to look at and work with the community on as we move forward. So that's the full part of this childcare piece, and it would be a transition of those children to other spaces.
Do we have, if it were approved by council, do we have a sort of timeline? I think parents are thinking that they're going to be out of childcare in January.
Yeah, no, I turn to probably Barb or Douglas to talk about the timeline again, as you said, if council were to approve this.
Yeah, thanks, Bruce. Certainly in the report, we project mid next year of 2021, if the decision is to be made to close them, with one of the centers taking longer due to some unique circumstances around the Elmira Children's Centers. we would be working together with the community to figure out what is the best time. We know that there are transition points that would make sense to close. So for example, as children enter into junior kindergarten would be a logical time that a large group, almost half of the children in our centers, would be making a transition into JK. So that's a natural transition time for them. And then of course, supporting the rest of the children and families in finding alternate care arrangements.
Okay. I mean, I'm not sure how much else I can ask. I know parents are super nervous about it, and as a parent myself, I can feel for them having struggled to find childcare. So I guess we just wait to see what regional council decides. Thank you for the answers to that. I appreciate it.
Okay, to that point, you know, we're parents too, and we all are understanding certainly of the angst that this creates, and that's why it's important. We know it's important to get the full story out. Someone emailed me this morning and said exactly like I'm out next week. No, we'll talk in the coming months to parents, and as Barb has said, there's some logical transition points where a number of the children won't be in our center anyway and transitioning to JK. So these are the kinds of conversations that we need to have, and anything that can be done to ensure clarity of message. We super appreciate you being engaged on this conversation.
Great, thank you all. That's my questions.
Thank you. Nicole, do you have any questions?
No, I apologize, not at this moment.
Okay. Joanna, would you like to ask any questions?
I'm good, thank you.
And I believe that leaves us with Tim at 570.
I'm good, thank you.
Okay, so I think that's it for our media partners, which will conclude today's briefing. Thank you for joining us today. We expect our next media briefing will be next Friday, November